Hello, my topic is about a 39-year-old woman with rapidly progressive respiratory failure. First, we have to understand what is a respiratory failure. A respiratory failure happens when there is not enough oxygen flowing from your lungs to your heart. Your organs, like your heart and brain, need oxygen-rich blood to function properly. Respiratory failure can also happen when your lungs can't remove carbon dioxide from your blood. So, there are two types of respiratory failure: when there's not enough oxygen or where there is an excess or exceed of gas. Here's a video about respiratory failure.
Respiratory failure happens when not enough oxygen passes from your lungs into your blood. Your body's organs, such as your heart and brain, need oxygen-rich blood to work well. Respiratory failure also can happen if your lungs can't remove carbon dioxide, a waste gas, from your blood. Too much carbon dioxide in your blood can harm your body's organs. Diseases and conditions that affect your breathing can cause respiratory failure. Examples include lung diseases such as COPD, chronic obstructive pulmonary disease, pneumonia, pulmonary embolism, and cystic fibrosis. Conditions that affect the nerves and muscles that control breathing, such as spinal cord injuries, muscular dystrophy, and stroke. Damage to the tissues and ribs around the lungs.
What are the signs and symptoms of the respiratory failure? Well, their principles are cough, phlegm, wheezing, respiratory difficulty, obviously, pain or pressure in the chest, and snoring. What is the medical care that doctors have to know when you have a patient with this type of disease? First, you have to control all the vital signs of the patient. You have to keep the oxygen level stable, and you have to place the patient in a adequate position, like you will see in the following video. That is a patient with respiratory failure. You can see that is clearly coughing, and the doctors put him in a good position. What's the issue in Ecuador? The prevalence of this disease in clinical service was 19.3% last year. In the distribution of cases by sex shows a predominance of 2.6% of the males and 74.1% of the women. 2 out of 3 patients had acute respiratory failure. And finally, here's a little explanation of the types of respiratory failure. There are 2 types, like we're going to see.
Of oxygen is less than 60 mm of H. Let us discuss about respiratory failure today briefly, type 1 and type 2. In type 1 respiratory failure, partial pressure of oxygen is less than 60 mm of Hg. In type 2 respiratory failure, partial pressure of oxygen is less than 60 mm of Hg and partial pressure of CO2 is more than 49 mm of Hg. In type 1, ventilation increases in relation to increase in partial pressure of CO2. Whereas in type 2, in some cases like COPD, ventilation does not increase in relation to increase in partial pressure of CO2. Treatment part: type 1 respiratory failure, oxygen, conservative medical treatment. If not improving, go for ventilatory support. In type 2 respiratory failure, firstly, go for ventilation improving strategies, and along with ventilation improving strategies, oxygen and conservative medical treatment.
So, in conclusion, interstitial lung diseases pose an important diagnostic challenge in geriatrics and also pediatrics. They are a heterogeneous group with common radiological, histological, and clinical characteristics, and have high rates of morbidity and mortality. They are characterized by inflammatory and fibrotic changes in the alveolar wall. Thank you very much.